So one thing that is common to most children with any sort of neurodivergence is that when things get overwhelming, they will have a meltdown. Meltdowns happen when information is just too much, and whether that's information from the senses, so there's just too much sensorily going on, or whether that's just too much thought, that can provoke this state of extreme psychological distress. And unfortunately, if we get our clinic visits wrong, that can send our children into a meltdown, whether they have ADHD or ASD. It's about putting too much demand on the child. So it's worthwhile considering how and when your child might have a meltdown. If you were seeing me as a psychologist, one of the things I might look for is what was the antecedent to that? What was the behaviour, which would be the meltdown? What was the consequence? And the thing that we're really looking here for is the antecedent. Was it too hot? Was it too bright? Were there too many instructions being thrown at the child? What were the situations that led to that? And see how much of that we can avoid if we're trying to put that into a clinic environment. It's also worth noting that when the child is in meltdown, there isn't very much that you can do about that. You have to wait until they start coming out of it to speak to them in a way that they can process.